Continue with free-flow irrigation. We see a lot of trauma here, but injuries to the eyes, they're different. So when a patient comes in with multiple injuries plus ocular trauma, chemical burns, thermal burns, foreign bodies, visible or not, the eyes can't wait. Fast, immediate treatment of the eye calms the patient, makes it easier to work on other injuries, which is why emergency treatment of the eye demands a fast, bilateral, hands-free method, one that gently irrigates or applies a controlled dose of antibiotics to the cornea and the conjunctiva. So just like over 90% of the emergency departments in the country, we use the Morgan lens. The Morgan lens is molded to fit the unique curvature of the eye and equipped with directional fins, attached tubing, and an adapter. Consider the alternatives for a moment. Traditional methods of eye treatment are inefficient, ineffective. But the Morgan lens, it's so easy to use. Doctors used to tell you to just patch the eyes and bring the patient in. But what if you could begin flushing the eyes and neutralize ocular pH levels en route to the hospital? All with this little device designed in the field by an ophthalmologist for treating severe infections. As a volunteer physician in Vietnam, Dr. Lauren Morgan ran across numerous ocular injuries. And today, thanks to his in-the-field invention, we find the Morgan lens works in all types of environments. Application is easy. First, if one is available, apply a topical ocular anesthetic. Then peel open the sterile packaging, and with the Morgan lens delivery set, attach an IV bag to begin a minimal flow. You can also attach a syringe for a smaller, more controlled application. Have the patient look down and insert the lens under the upper lid. Then have the patient look up, retract the lower lid, and drop the lens in place. Adjust the flow to the desired rate and absorb the outflow with the Mortan Mediduct or with towels. After insertion, the Morgan lens works on its own. Your hands are free to go to work on other injuries or transport the patient from the accident site to and throughout the critical care area. The revolutionary Morgan lens separates the cornea and bulbar conjunctiva from the palpebral conjunctiva, irrigating both surfaces and preventing symblepharin from forming. The Morgan lens is the only device to provide a positive and multi-directional flow throughout the cul-de-sac. This keeps the cornea, conjunctiva, and normally untreated inner eyelid thoroughly flushed. Foreign bodies, even the kind that can't be seen, are removed effectively and thoroughly. Once inserted, the Morgan lens floats on the very layer of solution it provides, separating itself from the tender ocular tissues and vaulting the cornea, never touching it. As the lens floats above the eye, preventing further damage from eyelid movement, the flushing process soothes the injury and provides instant relief to irritated eyes. Patient testimonies overwhelmingly confirm that the Morgan lens is more comfortable than conventional handheld methods. In fact, on many occasions, in cases of endophthalmitis, panophthalmitis, Stevens-Johnson syndrome, corneal abscesses, alkali burns, doctors have used the Morgan lens for continuous irrigation for 7 to 10 days, removing them only long enough to examine the eyes. Join 90% of the country's emergency departments and make the Morgan lens your first line of defense for ocular injuries. To place an order for your emergency department or company infirmary, just give Mortan a call at 1-800-423-8659. The Morgan lens, clearly the most comfortable, effective, and easy to use ocular irrigation system available.